Michael.
Hi, Allison.
And welcome to Deans Discuss COVID-19, a weekly podcast where we dive into the research that's being done at UC Davis, College of Medicine, and the College of Veterinary Medicine.
And today we're going to be talking about the surge, a disturbing surge in COVID-19 cases that is happening across the country right now as we're recording this, and what this means for states that have opened up again.
Yes, and we're going to talk about all the stress this is causing for our patients, for our healthcare professionals, and all that we're doing at UC Davis to relieve this. And, you know, it's been 3 months and we're still in this wave. I know that for me, my pets are really a big stress reliever.
Yes, for sure. And we'll be talking about that. I think one of the things that we sometimes underestimate is what effect a pandemic would have on all of us. And until it really happened, I don't think we really realized the depth of what it's meant to our society. And I think as we look into that, I think there's some tips and hints and things that I know that you're doing, Allison, at the School of Medicine. I know that we're doing here to support our faculty. And one of the groups that I worry about the most are frontline healthcare workers. And I know that those are right now undergoing severe stress and thinking about the problems that may occur if we have a second surge.
Well, one of the things we did is we developed a Hardship Fund, which we had really robust response in the community. And then we also developed a research fund. Our chair of psychiatry, Dr. Helen Kales, has developed a stress management and anxiety program that she's taken around to many of the departments, and that's been very well received. But you're absolutely right. You know, as a frontline worker, whether you're a nurse in the emergency room, a lab tech, or you're involved in making sure the hospital is just the cleanest and safest place to be, or a researcher, the daily barrage of information coming in and then trying to do your job. And then, you know, of course, people with little children have children at home because there's no school. It's coming at them from everywhere.
Yeah, I think that the fact that they do have multiple stressors all at once, we're seeing things like problems with sleep patterns, where people are not getting proper sleep. It comes out in social interactions. You may notice it as depression in people or withdrawal. During these times, I think we see it in our school as well, as we maintain our hospital and we continue to have patients in, but yet we have to function. And like frontline healthcare workers, when they go home at night, it doesn't leave them. They may have a family to take care of. They turn on the news and all we get is information. Like this week, we're getting increased cases from probably a lot of social interaction that occurred when we did start to open up and relax some of the restrictions. And unfortunately, there probably was a lot of gathering of people. We saw the videotapes from around the world, and people were they were pent up. They needed to have an outlet. And when that happened, they didn't follow social distancing. They didn't follow the personal protective things that were required, and we're starting to see that now. And so that's, again, we've stressed that multiple times on this podcast of the importance of that. I know you think a lot about that, and when you see those groups out there, I'm sure you're worried about those patients or those people ending up in your ICU or in your hospital.
Oh, absolutely. And one of the things I think that you mentioned is the idea of spreading amongst groups. And I think, there's a concept of the super spreader. And so, people are getting COVID from friends and family. And so that's one of the issues. And then they go to another place. And so it's really concerning to see the uptick in cases. I think that one thing I feel better about is, while there's an uptick in cases, I think we all have a handle on, one, the transmission, two, that we are confident about the type of PPE We know that we have trials out there when, remdesivir is now available through venues. It's been approved. That's a good thing. And there's more information out there about trials. But it comes back to common sense. And that's really social distancing, hand washing, and wearing a mask. And I can't say that enough, because we don't think that we're going to have a vaccine anytime soon, but wearing a mask is incredibly important, and we're really stressing that. It is required to wear a mask in our hospital, and you are given one in the hospital as well as in the other buildings. And of course, Governor Newsom says that that's really what everybody needs to do, is be wearing a mask.
Yeah. You mentioned families, and families, especially with children at home, that has to be particularly stressful. And, from homeschooling to not having daycares maybe available. And this is particularly relevant for people that aren't of a circumstance. They may be having to work themselves on the front line. One of the things I was really impressed with is the resources that you've developed. You have a kids considered podcast, and they devoted a podcast recently to the effect of COVID on children and the resources available for that. So, your pediatricians, I know, are thinking about this and providing resources for people with families at home, and that was wonderful to listen to and hear that. I have grandkids, and I think about my children and their grandkids at home, and so those kind of resources are particularly helpful for the stress of having that family at home. And then also discussing, why am I at home? Why are you at home? Why are we wearing masks? Tools available for that.
Well, I think one thing I really want to applaud the pediatricians for, and the rest of the health system, is really flipping towards telemedicine. So we flipped from 10 telemedicine visits a day to at the high of about 1,500. Now we're hovering around 600 or 700. And so we have the ability to do that relatively quickly. I personally think that helps decrease stress, because then people don't have to get in their cars and wear their mask and check in and all those things. They can just do that on their phone or their computer. And I hope that is really helping relieve people's stress. But the other thing is the whole issue of healthcare and the economy. So, I really worry that there are people postponing getting treatment because they're worried about their own job or their economy. And we're here to help with that. And we've actually put a lot of thought into that and have resources available for patients. So, we want to make sure that people go to the doctor. I'm a neurologist. I worry that people aren't taking their blood pressure medicine or aren't following their diabetes treatments and stuff. And we don't want anybody to have worse disease, cancer. We want to make sure people are going to the doctor and not worrying about. We've made the hospital very, very safe. We've made the clinic safe. And then we've also made sure that people get all the resources they need about health insurance, even if their own circumstances have changed.
Yeah, one of the ways that, our schools work together is thinking about that environment at home. And part of that environment is often with a pet. And one of the things that we've learned over the years for the value of having pets, both, let's say dogs and cats primarily, because they make up the majority of pets in the nation, is that they actually do help us with our stress. And so the positive benefits of having a pet at home when you are isolated or socially isolated, and this has been shown to be particularly relevant for elderly people that are isolated, that sometimes that pet is their only friend. We even have outreach programs called the Mercer Clinic with Loaves and Fishes in Sacramento to provide health care for the pets of the homeless. And in socially isolated situations, again, especially for the elderly, pets can be very much a relief. In fact, we have studies that show that if you have a pet in your home and you're around it, blood pressure can be positively affected, meaning it lowers blood pressure or it lowers stress levels. And, that unconditional love that a dog can provide can be an uplifting mental health experience for people. The other positive thing about pets is that we also want to have a stress relief. And one ways to do this through exercise. And I know that your school emphasizes that a lot. And so part of that is the daily walking, for example, of a dog can be a form of stress relief, but also help the patient or the person that's isolated exercise and get out in nature, for example, which is another stress relief. So we're finding a very positive, we're hearing stories about positive interactions and the value of pets in our home. We knew that, but this pandemic has really shown that.
So you're absolutely right, because Patches is one of my rescue border collie, and we've taken to exercising in the morning
Mhm.
because exercise is one thing about self-care, and getting your dog out to walk, or in my case run with the
Mhm.
border collie, is really, I think, very important about self-care, making sure that you get enough sleep, making sure you limit other things like, too much alcohol or too much staying up late or too much
Mhm.
gaming. There's
Yeah.
a lot of social isolation. And then, I get concerned about people in Zoom. I know that if I'm on the computer up late, working or have lots of Zoom meetings, it takes a little time for your brain to turn off. And there's something else about the interaction of Zoom. I love Zoom and I love WebEx, and they're great, but that, being on the computer all the time, I think is changes your wiring a little bit. And I think people need to be mindful that they need to decompress more when they go home and not just be on electronics. We tell kids to limit screen time, right? That's what you tell little kids, and you don't want them on the screen all day long. And here we are, all trying to do our jobs on screen. And then you take the stress of going home and having to, do homeschooling and manage everything in a new and different way. I think it's very stressful. I think it's something that we're not appreciating as much. But I
Yeah.
give you kudos about, getting your animals out and about. That's a really important, getting a little bit of vitamin D, some sunshine too,
Mhm.
and making sure that you're getting, in touch with friends and family, even though you may not be physically with them. I've taken to making sure that I call friends on the weekends and talk
Mhm.
with them. And but boy, it's so important. And this is going to be a marathon. It's not going to be a sprint.
That's a really good analogy, actually, because we know that, as the surges have come out on this, so-called second wave, or we may have others as well, or they may be associated with events in which people don't, physically distance. And so that stress is going to be a longer term thing. We're going to have to live with this virus for a while, and it's not going to go away until we have a vaccine, which could be, still a ways off. And so because of that, we need to look for other ways to interact. And we're a social species, just like animals, and we are an animal. But I imagine Patches also may react to your stress. In other words, we know that dogs can sense emotions in people, and they have been used as therapy animals because of that. And in some ways, they know us better than we know ourselves, and they can sense that. The other side of that coin is we have veterinary behaviorists here, and our veterinary behaviorists are getting calls also for the opposite issues, which is anxiety in pets.
Oh.
And when they are in a situation where they don't have the same things, they don't have social interactions, or they're cooped up, they can also have behavioral issues. And so our behaviorists, one of the most common things that veterinarians ask about, aside from skin problems sometimes, are behavioral issues in animals. And so there's a lot of treatments for that. There's a lot of ways that people can interact with their pets to decrease that. But during this pandemic, a lot of the dog trainers have done the same thing we've done. They've had to go to Zoom, they've had to go online, and that's not quite the same for an animal to be. It's harder to get Patches probably to listen long enough on Zoom to be able to be trained and talk about his anxiety. But it's interesting that it goes both ways. But the other thing you mentioned is the adoption of a pet.
Mm-hmm.
One of the positive things we saw is the shelters early on in the pandemic actually cleared out a bit. We had shelters that didn't have any animals because people did go and adopt or fostered out those animals in shelters. Now, that may not be the case long term. They may fill back up again, but that was an interesting social experiment early on in the pandemic.
I talked to a faculty member recently, and her son had wanted a dog, and I met him 6 months ago, and he was telling me he wanted a dog. And then recently, she said they did get a dog, and they got a rescue dog, and it was during the pandemic. So you're absolutely right. One thing I also will say for the older population, when you take older individuals who may be functioning very well, but you change their pattern, such as suddenly they have to live in a different environment, or they have more people in their house, or they have to leave their house. That's also something that causes a great deal of stress for the older individual. And that can unmask some mild, what we call mild cognitive impairment, just some mild things that, really wouldn't be seen if they were always in their house and in their usual pattern. So I think that's another thing that the pandemic can bring out is suddenly you have more people in your house, or your patterns changed. I think that's another thing for people to be aware of. It's just incredible the impact that COVID has had on us. Then you layer on the economy. There are so many things going on. And of course, the issues about systemic racism on top. I can't think of any other time where there's been so many stressors, and the news daily about people dying from this disease and other people not taking it seriously. So as a physician and you as a veterinarian, I mean, there is a lot going on in our worlds and a lot going on in our patients' worlds, our students' worlds, faculty. It's really a tumultuous time.
Yeah, I think one of the things as colleagues that we look for is, and I know you do this with the medical students, is we try to essentially train them to look for signs of depression, signs of that somebody may be in trouble, and to help and ways that they can report that. And I think it's important for people to look for that if they see an individual that is starting to show signs, whether they're depressed or whether they're isolated. And you mentioned, it's really important for our social interactions. And Zoom is not going to do that. You're not going to be able to get that interaction the same way. And if we have resources, I know both at the medical school as well as at the veterinary school for our students, we also find that our staff and our faculty are needing that as well. And in particular, when they have additional stressors, like having a family to take care of or financial pressures. So I think all of us need to have self-care in mind and then care for us as a community. One of the things I think that the positive side of a pandemic also is we've seen a very loving community reach out to people and to offer assistance, or as you mentioned, help when somebody is in a situation where they are isolated and trapped. And so I think that we're a natural caring profession, both veterinarians and medical doctors. So we are looking for those ways to be compassionate and reach out. And certainly there's a huge need right now.
Yes, I agree. And, one thing that we might think about is some resilience and trying to figure out what makes some folks more resilient or others. We've really begun to think about that in medical students and in physicians. I have a theory that it's just what you said, being engaged in with colleagues, and that is a really good thing for people to feel connected. I think when people are by themselves and don't have colleagues, don't interact, or don't have social things, don't get exercise or sleep, or those are the things that kind of begin to chip away at your resilience. And so, as you mentioned, self-care, I think people should think about what is going to make them resilient in this tumultuous environment. So this has just been a really interesting conversation, Michael. I have a question for you. Our nation has challenges with food insecurities before this pandemic. How do you think this has affected how people get food?
That's a great question. One of the things that was an unexpected negative thing that happened during the pandemic is disruptions of our food supply. And in particular, we worry about that for folks that need that food. So, for example, during the school lunch programs that were disrupted. So that's going to be a very interesting topic, and how UC Davis is involved in finding solutions to some of these problems that we've had in our food supply. So I'm looking forward to talking with you about that, perhaps in a future episode.
That sounds great. It sounds like a great topic. I'm Alison Brashear, the Dean of the School of Medicine at UC Davis.
And I'm Michael Larimore, Dean of the School of Veterinary Medicine at UC Davis. And you've been listening to Deans Discuss COVID-19, which is our podcast that we'd like you to subscribe to. And please don't miss another episode.
So we welcome your questions and ideas on future episodes. You can email us at deansdiscuss@ucdavis.edu. And in the meantime, you can visit ucdavis.edu/COVID/19 for the latest coronavirus research from UC Davis. We'll see you next week.